Sonography of endometrial polyp. Endometrial polyp is a mass situated within the endometrium, affecting both premenopausal and postmenopausal women, specifically those treated with tamoxifen. It is predominantly benign, however, it has risks of malignancy. Its peak is mainly between the age of 40 to 50 years. However, it can occur in any age. Clinical presentations and symptoms of endometrial polyp includes 1. Dysmenorrhea, which is painful menstruation. The second one is infertility, inability to achieve pregnancy, or even when pregnancy is achieved, the patient will not be able to carry the pregnancy to term. Menorrhagia, intermenstrual bleeding, and longer than normal menses.
Sonographic features of endometrial polyp. It appears as a homogeneous hyperechoic mass, often ovoid in shape. May have surrounding fluid collections and a connecting stalk or base. It is rarely heterogeneous, but it can be isoechoic and it can also be heterogeneous. On color Doppler interrogation, a feeding vessel sign is seen. The feeding vessel sign demonstrates the connecting stalk, which is its attachment to the uterus. This feeding vessel sign is not pathognomonic to endometrial polyp, as it is also seen in submucosal masses, and it's also seen associated with endometrial carcinomas.
Here is a case of endometrial polyp. The patient is a female 40 years of age with clinical history of menorrhagia and dysmenorrhea. You can see a well-defined homogeneously hyperechoic mass distending the endometrial cavity and surrounded by a ring of anechoic free fluid collections. On color Doppler interrogation, a connecting stalk was demonstrated, or a feeding vessel was demonstrated. This feeding vessel is the connecting stalk or its attachment to the uterus. Here is another case of endometrial polyp. You can see in the endometrium. It harbors a well-defined homogeneously hyperechoic mass seen within the endometrial cavity. On power Doppler interrogation, a vascular stalk was demonstrated. This vascular stalk is indicative of its attachment to the uterus. The mass measures 17 by 6 millimeters. Here is a video of the case we just discussed. You can see the endometrial polyp surrounded by a rim of free fluid collection. It is echogenic, well defined with smooth border. On power Doppler interrogation, you can see the feeding stalk showing its attachment to the uterus. Let us look at this image very well. Is it an endometrial polyp? Well, let's look at the features. The mass is hypoechoic. It has sound attenuation. The overlying echogenic endometrium shows that it is being distorted and displaced anteriorly. There is distortion of the interface of the endometrium and myometrium. The features favors a submucosal fibroid mass.
This is a case of submucosal fibroid. You can see it is so different from the endometrial polyp. The mass is well defined, more hypoechoic than the endometrium, with a strong sound attenuation. There is distortion of the interface between the endometrium and the myometrium, and on power Doppler interrogation, a rim-like or semicircular pattern of flow was demonstrated. These features are strongly indicative of a submucosal fibroid mass. However, saline infusion sonography is advised for further detailed evaluation of the mass. Saline infusion sonography has a high diagnostic accuracy for endometrial lesions.